A few more minutes. We're gonna get going. So today we're doing the part 2 of our client outreach, following up from our first delivery a few weeks ago. And today we're gonna focus on how do you incorporate those outreach techniques into your program. And so we're gonna talk about a few areas where you can incorporate, but then we also wanna hear from you about how you could, in what areas or processes in your own program, you can maybe integrate some of these techniques that we're going to be talking about today. And then also lessons learned, what have been some challenges, and maybe hearing from other programs on how they've dealt with those challenges as well. So we want to have time to have a discussion about challenges and then lessons learned and ways to get around it, okay? So thank you for your participation. And Heather McGrain-Minton was our presenter for today. Unfortunately, she had a family emergency this morning. So Dr. Ann Dozier will be presenting in her place.
So hello, everybody. I will do my best to sub in for Heather, who has been preparing and working on this and the prior presentation for some time. So I will hopefully be an adequate substitute. So this, so we're looking at how you're incorporating effective outreach techniques into your work, and based on the previously learned successful outreach models that we drew from the literature and from different experiences that the sites shared. The goal for this webinar is to provide information, again, on this incorporation of best practices. We're going to discuss some common barriers to incorporating techniques and provide some suggestions on how best to effectively reach your priority populations. This webinar is the culmination of a two-part series on outreach strategies, and we'll specifically address how to use these tactics to improve your outreach. And this is being presented for the Mitch staff. So we have 4 main objectives, and using the recommendations from our first outreach webinar, we'll be going through various scenarios and tools to see how they relate. We'll be basing our discussion on the social marketing approach that was presented or introduced in the first webinar. And so we're going to be looking at how you're currently incorporating outreach, some common barriers to incorporating these promising techniques and strategies into your work, and then identifying useful strategies and how to overcome them. And then we'll have an opportunity for questions and concerns you might have. Now, at various points in the webinar, there's going to be an opportunity for people to either answer a poll and or have a discussion. You can do the discussion either by typing into the chat, which we will then repeat to the group and comment on, or people can unmute, or if you raise your hand, we can unmute you so that you can talk about your question or response to or your answer to the question. I think we generally prefer that people talk because the typing and chat box sometimes loses some in translation, beyond the fact that not everybody may be an outstanding keyboarder. Okay, so moving on. So this is just a reminder that the social marketing approach includes the 5 Ps. So we look at potential participants, how you identify individuals who are meeting your criteria. So if you're conducting outreach focusing on prenatal care, then your potential participants or clients would be pregnant women. The product, again, these are what are the materials you're using. So that might be flyers, brochures, handouts, items that you may be giving to clients or potential clients. Price, which ties into the resources you have access to conduct your outreach. So this could be some incentives or something at the organizational level. So this can be viewed at the organizational level as well as at the individual level. So the organizational level would be, how they structure outreach. Some organizations may choose, for example, to hire somebody who's solely dedicated to outreach. At the individual level, it really is ties into incentives, and incentives don't have to be things you give people. It can be incentives to in terms of getting more timely care or something on that vein. Place, which is where are your best locations. That could be setting up a table at a WIC office or attending a community event. It also includes being located where your priority population is, so a grocery store or a hair salon. Again, it's going to, not expecting your client, your participants to kind of come to where you are. And then there's promoting, the promoting message. What's the message you're sending relative to your program that will make them interested? This could be focusing on the health of the woman, the baby, or the family. So it's like, what's the hook? How are you kind of getting them interested in what your services are? And then in working with partners is also included in this overall approach. And this includes both formal and informal partnerships or relationships that facilitate outreach or benefit your work. And this can range from having a formal referral process in place from a particular center or healthcare center, or being welcomed into neighborhood stores to conduct outreach. So again, these are the 5 points in the social marketing approach, and can be used as a framework for your strategies. So now we're going to talk a little bit more about some recommendations that have been identified as promising approaches from the literature. So use of the culturally appropriate outreach. This is the product or the P part, and we're going to talk about that a little more on the next slide. Other things to look at is the meaning, language of choice, the pictures. So some of what culturally appropriate is, it's the language that's being used, the pictures that are relatable to the clientele that you're seeking to engage with. That it's the reading part is appropriate for the grade level, and so you really want to have something that when somebody looks at it, sees the words on it, that they can relate to the picture and that they can grasp what the message is in what you're reading or what you're presenting to them. There is a CDC document that provides a lot of information that you'll find useful, that we'll talk about a little bit more in a minute. So another part of recommendations is use of social network. So this cuts across several of the different P's, including place, potential participants, and promoting, as well as working with partners, with the notion that you do outreach in a lot of different ways, not just one way, and it may include going to sites such as churches or workplace or schools. It also may include social media. The third is having a presence in the community. And again, this is that formal and informal partnerships. And this is, this in terms of the P's is place and working with partners. So it's important to be visible, kind of, so people get to know you on a formal and an informal basis. It's not, in research, when we talk about this, we talk about researchers being helicopter researchers, where they drop in, do their work, and leave, and they really don't engage with the community. They aren't a presence and aren't known. And so it's how you break down some of the barriers of engagement is that you're seen as somebody who is in the neighborhood or in the area regularly. In order to be visible, though, you need to figure out where places that your priority population may be themselves hanging out. So this would be either grocery stores, the salons, churches, community centers. But that's where your knowledge of the local community becomes important, and your partners help you with also understanding where the local community hangs out. Another item of recommendations is this notion of incentives. And while while there are limitations to how you can expend funds to purchase incentives for distribution, it doesn't mean that you can't use other funds for this particular activity. It is considered an evidence-based strategy, but just like we can't use food to buy things using state money, there are other limitations on that. But other funders or other sources of funding may be useful. I know one of the things that we did when I was working with our Healthy Start project is they got donations through a food bank that actually had non-food items that they were able to take advantage of. So I think there are sources for these, but it will require everybody to be pretty creative about where they come from. Again, another part of this recommendation is focus on the health of the baby or the child, and this is that promotion. So if the woman insists that she's doing okay, if you focus on the baby or on the health of her baby or her other children, you may be able to engage her that way and provide her assistance with them, and then indirectly, get more engaged with her, and then she may find out that she actually has some concerns. So she may say she's okay, but once she sees how you have helped her with her baby or a member of one of her other children, she might then say, well, geez, I really could use help with this for herself. And then I think it's important to not just rely on one single strategy. You want to do different strategies. So combine engaging with people with your own social network. This is actually one of the strongest recommendations. A multi-pronged approach has been shown to be the most successful, and I think that depends on kind of where you are, what strategies you feel comfortable with, but to only ever do one approach is going to limit who you are able to engage with. The other, and this is more at the organizational level, is to have an individual who's dedicated to outreach, and that this is considered useful in successful enrollment of participants. This is part of the P or price component. And it's based on information that we've identified in the literature that a dedicated a dedicated outreach worker or coordinator or even a team may very well be more successful with their outreach. In some respects, it's because they probably are going to be able to be more visible or more consistently visible in the community. And while this does have certainly financial implications, we don't want to just not share that this is an option that has been well described in the literature. So moving on to designing communication materials. So this is just some additional detail from one of the recommendations we just went through. And it's important. What we want to do is kind of step back and discuss the use of culturally appropriate outreach and program materials. And the CDC has a resource that's called Simply Put. This has been around for a while, but it is it is an excellent resource. So we're going to focus here on their suggestions for developing a communication plan. Now, the key is that there are lots of steps in developing these communication materials, and that these steps are considered evidence-based and are considered, kind of user-friendly here. So of these, we want to identify who that intended audience is, kind of define or determine the key health problems or interests of that particular audience. So don't go in assuming that what they need, what their interests are, how they talk about their concerns or problems or the issues. The second piece is really, engaging that audience to determine their needs, their values, what their interests are, and even what their level of knowledge is about a topic. You may assume they know a lot when they don't know very much, or vice versa, depending on kind of how engaged they are with the health system or what kinds of other services that they may have used in the past. So they may know a lot about smoking, but they may not know a lot about breastfeeding, for example. Another piece is to determine the key concepts and messages based on that. So you go from figuring out who your audience is, defining what the issues are, figuring out what they know about those issues, and now really distilling down and figuring out what is it that you really want to communicate to them. Then the next steps, which are very logical, logically flow from that, are that you're going to design a draft of the information and you want to pre-test it. So have a lot of different people look at it. Have people from within the agency look at it. Have people from outside look at it. Have potential users look at it, and have it. You don't just say, what do you think of this? But you have some people look at it for kind of accuracy, grammar. You have others look at it for what's the message that you think this is trying to get at, so that you get, and can people, how easy is it to read? Does it make sense? And because it may be a lovely document and does all that, but people might say, well, why are you giving me this? It doesn't make sense to even give this, or to understand when they might use it. So pre-testing those materials, and then you do some tweaking of it, but that process, it can be iterative. You may require several different cycles through because of the suggestions you get, depending on how large or small the recommended changes might be. And I would say, as much as it's easy, you'll get feedback and you say, well, that's kind of bogus, or that you need to trust the feedback, particularly that you're getting from the audience. If they say it's not going to work, don't think, well, I know better. You really need to hear and be clear about and pay attention to that feedback. So then obviously you're going to publish and distribute materials, and then really determine what the satisfaction and understanding of that is. And that's something that you as individuals might not be doing. It would be really part of the evaluation that's being conducted at the organizational level, although you may be some of the data collectors to say, geez, was this information helpful or useful, et cetera. But that would be done, as I said, coordinated with kind of a larger organizational effort or program effort about how well the materials are working. And what you may find is that some materials may work better with certain audiences or not. You're going to find something that may work better with the younger mothers, and other things may work better with the older mothers. That's not a surprise. Okay. So now the question is, how can we effectively use these recommendations to improve outreach in your community? So at the organizational level, the individual worker may not have as much control. So in terms of the design of the materials, that may be more driven at the program level, use of incentives, use of a dedicated outreach worker, as well as evaluation of the program. But at the individual level, the CHW has more control in terms of connections through a personal social network, formal and informal relationships in the community or with other partnering agencies. You have more control about how you act, what the message is, or what you actually say, and how you engage with individuals, and also the use of a multi-pronged approach. So these things, so you're not, as individual community health workers, you're not working kind of outside the parameters or the boundaries of what your organization expects you to do. So what your organization wants to do and what materials they use obviously affect what you do, and what you do can inform and shape what the organization chooses to do and prioritize relative to outreach. So how are you identifying who your who your potential participants are? So I think what we want to do is have a little bit of a discussion about how you're identifying your potential participants. Are there different places you conduct outreach? Do you look for participants in different places? So we really want to open this up to hear a little bit about what are your approaches? Are there things that you've done that you've found to be effective in terms of identifying, your potential participants, or there are things that you've tried that have worked, that haven't worked? So you want to just open this up for some discussion. Feel free to put your hand up and we'll unmute you, or you can unmute yourself, or if you want to chat in the chat box.
My friend, I'll be 21 now.
Okay, somebody's talking. Please speak up. Okay. Comments in the chat box, or please raise your hand. Okay. Any other? Okay, well, we'll have opportunities to kind of come back to this as we go forward. So we're going to now have a scenario that maybe this will be more easier for people to comment on. So take a minute to read this, but you're looking to conduct some street outreach. The outreach worker or community health worker is intended to approach a woman who appears to be of childbearing age or who might look pregnant. You're thinking about doing this around a local grocery store. You have a handout from your agency that you're going to be providing the person that you speak with if they're interested in that. And then the question is going to be, when you think about this and think about the 5 Ps, what aspects of that are being addressed? And then are there other parts of the social marketing model that they could consider doing? So kind of chew over this scenario. And we're interested in what do you think about this? What if you go back to those 5 Ps, which is the price, product, place, promoting, and participants. What thoughts do you have about that? Might want to ask is why did the grocery store get picked? How did you pick the date, time, and how long you might stay? What are the materials you might bring? Thoughts and comments? We really, are looking for what people think about this approach. Okay, so I gather people are not being very chatty here. Okay, well, we're going to move on. We'll maybe come back to this, or this will come up in another area. So now we're going to ask a little bit about the product. So this is another opportunity for you to participate. You don't have to talk or type. You just need to click the box there. So what types of products do you currently use in your outreach activities? So we'll give you a few minutes to complete the poll. Just click on the boxes there.
And after you've selected all of them that apply, make sure you hit submit so that it will transmit through to us.
Okay, we've got Mhm. So thank you for clicking on this. I was beginning to think that people had fallen asleep. So okay, we'll give people just another minute here, or only a few seconds. I'm sorry. We got pretty much. We believe we've got just about everybody may have responded. Okay, we got a couple more. We'll wait for.
Okay, we'll go ahead and end the polling now. We'll give you another about 5 seconds here. Go ahead and hit submit. Okay. And here's the results of the poll.
Okay, well, first of all, thank you for your replies. The two most common approaches, as you can see, are using posters and flyers, as well as word of mouth. And then some lesser used options are, booklets, some advertising, so that includes some media such as TV or radio, personal contacts, so maybe through a social network, others through social media. There's some lesser use of email and enrollment incentives. So what we'd like to do is talk a little bit about how do you figure out what to use or not use, and whether you have a product that you use, kind of just one product that you use for everybody, or do you have kind of multiple products, and how do you determine what is working best? So we want to open this up. You're clearly out there punching the buttons here, so we know you're there. So we're really interested, and this is not for me to learn, but for you to learn from each other about kind of how have you figured out what to use, or what approaches to use. So again, you can type a comment into the chat box, or you can raise your hand, or you can unmute yourself to be talking here. Okay, so nobody's really interested in sharing some of that. I think, what's interesting, I think what's important is that it's clear that people have generically, we're here, somebody has commented, thank you. You get a special point here. It says word of mouth has worked really well. And we saw that it did, especially when we would do parenting and support groups. More clients would roll in after those activities. So we're doing a parenting group and a support group, and that you then can talk about your agency, and then clients would come in. I'm assuming that those are clients, those are people who are at the support groups, as opposed to the support group telling somebody else to come in.
Hi, this is Cheryl, and can you hear me?
Yes, we can, Cheryl. Thank you.
So we've got a couple of our CHWs here. They're shy. They wanted me to say that they go out using flyers, because the flyers then give them an opportunity to give something to somebody and start the conversation, because they have something with them, as opposed to trying to start a conversation without having any material.
So in that case, the flyer isn't, so when I think about flyers, I think about things being posted on a wall. In fact, it's a flyer that you're actually handing out to an individual. And then based on the flyer, can engage in that, in a discussion with them.
Correct. The flyer, you're saying also brochure, just something, right? So flyer, brochure, just something that they can then give and start the conversation around that, that piece of material.
Right. Like, what have you heard about what have you heard about? And I think the other thing that's interesting is that as you talk to people, it's really easy. We're safer oftentimes asking closed-ended questions. So, have you heard about thus? And somebody can just say no, and it shuts down the conversation, as opposed to asking the question of saying, well, what have you heard about? So what have you heard about our agency? Or what have you heard about, something that's going on in the community? And it keeps that, if people can answer the question in a yes, no, it shuts down the conversation more. It may shut that down more, I suppose. So you could give them the flyer saying, not certain if, what you may have heard about this. Somebody else has commented that walking up to people and having a conversation and going to local Department of Social Services. So using one of the sites that people go for some of their, to get some of the social service programs. Another comment is that I think it's important to understand what people are more comfortable with. Some prefer their electronic devices over a piece of paper. Others still need more pictorial brochures due to lack of education. That's a very important point. So it speaks back to the multiple strategies also, that people have different, connect with communication in different ways. I was at a meeting yesterday when they talked about the fact that so many more people are relying on videos for, their information and whatnot. And, in the era I grew up in, that was certainly not something that, was even particularly a very prevalent option. So I think understanding that, and maybe having a couple of different options with the same message. So a handout with a message, and pictures, which I think is a very important point, as well as something that can be more of a video or social media communication. And then location is a key to reaching people, for sure. And that ties back to the earlier comment about going to the local health department. I think the other is, where are people kind of hanging out as opposed to rushing in and out? At some places they're going to be sitting for a little while, so they may be maybe a captive audience, so to speak, and would be more amenable to engaging as opposed to when they're rushing in and out. That was one of the things I, think about, with a grocery store. If I think about, the times when I go shopping, I'm usually on a mission to get in and out of there as fast as I can. And that might, I might be more likely to, not engage as opposed to time when I'm, sitting around or standing around, tapping my foot, waiting for something to happen. Other text comments or any other comments over the phone? And you all don't have to be shy. We all are interested in very much hearing from you. And while you may not think you have valuable perspectives, you actually have very valuable perspectives, because just like we want you to learn from your clients. You talking to us helps us better learn what your needs are. Okay, well, we're going to move on to another scenario. So this is one in which we're looking to do recruitment at a clinic that specifically serves the lower income women or families. And you have a flyer that is used to for distribution, and you're thinking about setting up a table maybe at least once a week on the days that the clinic says it's busiest. So when you're looking at this, what are the kinds of things that you would want to know about what might you want to know before you made this decision? And before I go into that, I want to comment. We got one more comment in the chat box that says, also small talk and compliments help with connecting to participants. Absolutely. And I think sometimes we think that small talk is a waste of time, but it does give people, you engage with people on, what are some of their commonalities and some common interests. So back to the scenario, if you were considering this, trying to setting up a table, it's potentially the busiest day of the week. What else would you want to know before to inform that decision? Think about, you don't just, you could just go in and set up a table, but you really want to program this for success. So what would you want to know going in about?
And
Yes, go ahead.
Cheryl again. So as I think of it from the administrative standpoint, the thing that stands out here for me, if this was something that the staff or the team was suggesting or recommending, if MISH is supposed to get women who are not already into care, going to a health center, they're already in care. So that's where I've got some concerns as to whether or not this would be an appropriate venue for MISH outreach. Are we trying to get people that are not in care, that are in care, but not getting some specific things we want them to get? Or does this bring us back to the community organization level where we should be having more conversations about strengthening that system of the services they get because they're already connected in care?
No, I think it's an excellent point, and because we do know that there are people who are engaged in care or who may be coming in, and this could be that, it could be at a pediatric clinic and, the mother's there with her child, and so the child may be getting services and maybe the mother isn't, or we could be looking at, in some communities have a pretty high rate of that there are not as many women who are uninsured, but the women who are insured may not be getting the services or seeking the services. If we think about things like, long-acting contraception from an interconception standpoint, maybe they're less likely to be, we might want them to ultimately talk more about getting a more effective or longer-term contraception. We also may want to, talk with them about other programs that they may be available, because at a clinic, the provider may say, well, geez, you need to stop smoking, for example, but the smoking cessation services are going to be something that the woman may need to seek outside of the context of it. But I think you're right. I think and tied back to who are the potential participants, who you're going to get in a health clinic setting is going to look different than the people who you're going to find out in the community. Some other comments here are what age group comes to the clinic, and are they considered kind of at risk for that? You really want to find out kind of how many people, when they say it's busy, what does busy really mean? As well as kind of the demographics. It gets back to this, what's the age group and what's the high risk? Are they high risk for that? Also, to really see if our service is needed to the population that clinic serves. I think that kind of ties back also to Cheryl's point, because there can always be, a mismatch where you're going into a place and you have services for interconception women, but the clientele that they're serving really doesn't. They're not in a level of readiness for that kind of information. I also think it depends on, if you look at the organizational program level, if you look at your profile of the clients that you're already serving, who are you not serving? So are you not getting to the younger age women? Are you not getting the interconception women? And that also helps you align with what the demographics or what this particular clinic serves. Another comment is find out who is providing similar healthcare services and the gaps in services among the health clinics. I think that's another interesting point, that you may be a gap filler for that, and also in terms of understanding so you've picked a particular clinic, or people have thought about this, or maybe there's a different clinic or a different site that could be available. Other questions, comments? There are a couple of things that struck me about this, is that, that there's a flyer that's been developed according to the scenario. I think making certain that the flyer is acceptable to the clinic is important in that, so what do they think about it? They may look at it and say, oh, that's great, but our clientele aren't going to understand your message, or it's not simple enough, or it's kind of the wrong picture is on it. That's one of the reasons why it's helpful to do all of that pre-work with the program, or when you're developing your brochures. But I think understanding what their take is on the clinic, and I think the other is to ask them, the clinic, what they have found to be effective in engaging the individuals who come into their clinic. Because I suspect this would not be the first time someone has been recommended to or wanted to set up a table in the clinic. So they may have a sense of what has worked and what might not work. They may even think that setting up a table isn't the way to do that. And another comment about, yes, making certain that the images are culturally appropriate for that group. Sometimes, because images are a little more expensive to put into brochures, many times people will use more of I'll say a stick figure, but something that is maybe more, kind of culturally, not culturally specific, so that they may not be able to use pictures, particularly if you're trying to create brochures or things that have appeal to a larger audience. I mean, you really like to do pictures because it feels more personal, but it may add to cost and whatnot. Okay, we're going to shift gears just a little and talk about some of these images. We have a couple of samples of items that we want you to take a look at. And, in thinking about, what are the things that appeal to you about this? Does it kind of follow some of those good rules of good materials? And what might you change? So if you're thinking about the P's, it's, kind of what's the message, who's the best group for this, where might this be used, and is this something that you might be able to adapt and use for your outreach? So we're interested in what you think about this particularly. This was developed in Washington. So it has some color to it. What do you all think?
So, and my shy group here again, they say, I'm going to say that, maybe you will say it yourself. They like the word help on it because it just tells people sometimes that draws people in, and the image is nice. It, again, is telling them who we're targeting. And the colors, did you say? Or I made that up. Sorry, they didn't say the colors.
Comments from other folk? One of the things that struck me is the first dot point, which says free developmental screening without wait lists or income lists. That is an incentive to participate. Again, it's also getting at the going after the health of the baby, but through that you can bring in the mother.
I think the fact that they even bolded certain words in those dot points just to draw attention.
Yep.
It's a different way of getting attention from your audience. And I think at the top where it says, help me grow Washington connects families to the resource needed to give all, and notice that it's all capitalized, all kids their best start. It's very inclusive. What else appeals to you?
Yeah. What else strikes you about this?
Go ahead.
The flyer might actually be a little too wordy.
Okay. And who's that that's talking? I'm sorry. Is that?
Allison with Cheryl's group.
Oh, okay. Hi, Allison. Thank you for being bold enough to speak. We really, 2 points for you. Yeah, so it might be a little wordy. Yep. I wonder we didn't put this through there's actually a feature on in the Word program that it'll evaluate the readability of the text, and I don't know what grade level this is written for. It looks like it's above. It's at least. Because you really want things to be at like the 6th grade level or below. This looks a little higher than that. But you're right. I think a shorter or a more concise message might strengthen this. And let's see, we have a comment here saying, we think that the focus is primarily on the child and not on women and families. Yes, so that can be, so I'm assuming you're saying that because it's I don't know whether you're saying that that's an upside or a downside. It's certainly if you're trying to engage mothers, this is going to engage the mother through the child, but it really doesn't talk about her health needs. Other comments? Okay, we have another one of these to look at. Now this one is a little busier, and it's really a different kind of outreach, which is really more targeted for employers or businesses. With this. So again, not a client one, but one to engage with partners who may be serving your clients, serving them in terms of them being employees. Any kind of impressions about this one in terms of how it's laid out? I mean, yes, it does have lots of words in it. Even though it's labeled as fast facts, I mean, it's not, you have kind of dot points in there, but I'm not certain how easily this, whether this is considered, whether I might consider this a fast fact. Thoughts or reactions to this?
With all that said, having those green bars can at least stop the eye and bring the reader to what the details they would want, so they don't have to be as overwhelmed with all of those words.
Yep. No, I totally agree. I mean, it really organizes it in a way that makes it more digestible. Because people who get it may already know about WIC, and they may be interested more in like how I connect my employees. Let's see, we got some other comments here. Just too many words, yeah, okay. And then it would depend on really who's the audience, right? So this may be something that's more appropriate for the employer as opposed to employees, although this could be distributed, an employer could copy it and distribute it out to their employees. And they do have, as we can see, a visual in there that's a picture of a mother and her baby making looks like they're making a food in a blender. Okay, so I think we're going to move on to another scenario. Thank you. I appreciate everybody's comments. So this is one where you have been invited to a meeting with other outreach workers. and they serve a wide range of different kinds of clients across their programs. So some have clients that include men, older or younger women. Some of them may serve teens. And the kinds of services, they can range from either a homelessness program or to a healthy lifestyle program. So a broad array of programs, not necessarily maternal child health focused, certainly not limited to childbearing women. So in thinking about this, how might you work with these folk to help you with your outreach? We sometimes might refer to this as kind of like the secondary outreach. And if you're if you're looking at how to work with this, what might be your first, steps in engaging with these women? So this is kind of this is helping you develop your network. What do you think? Has anybody been in this situation or gone into meetings like this? Just interested in what kind of experience you might have had? Because this is a valuable strategy. We talk about those multiple strategies. While we talked about that in the context of the individual client, this is another strategy that adds to that group of strategies. So you do your own outreach, and then you work with other people to help you, with your outreach. Comments? The key for any of this is that you would go to this meeting with a plan, that you would really want to make certain that you knew, kind of what was your goal in going there, and is it to make certain that people know that you have a program that serves women, or do they likely know that and they really need to know a little bit more about the specifics of the services or of what kind of clients that you're really looking for. And I think importantly, connecting the people who they're seeing to help them see how their work can connect back to yours. So they may be serving men, but those men may be in families. So there may be some needs that your program could serve relative to the women in those families. It could be that they're dealing with individuals who are homeless, and then it's like, how could you then talk to say to this outreach worker, okay, this is how my program can help you. You should never depend that people can see the connection. It may be really obvious to you that, oh, well, of course we have this program and it should be obvious how they could refer to us. It may not be. A lot of that's because they're so focused on their own program, they aren't kind of thinking beyond that. But I think it's important for you to understand or to be able to help them see that. So we have a comment. Thank you, Melinda, to bring outreach materials. So bring some of your materials and to describe the program in 1 to 2 minutes. So this is what we call the elevator speech, where you distill down what you do or what your program does into a very digestible sentence or 2 sentences that one would, and it's called the elevator speech because it's, you get on the elevator on the 1st floor and you ride up to the 10th floor with somebody, and in that period of time, you want to leave them with information about either who you are or what your program is. So the additional comments from Melinda are that would include a referral process, what languages your services are in, which is, critically important. And then to inform who you collaborate with. If I can read this right, with organizations to service needs out of your program description. So I'm not certain I fully understood the last piece there. But the notion of, making certain people understand, who you are. But I think, as I said, helping other people understand how could their outreach be strengthened by referring into your program? And how could the services they provide be strengthened?
Right. And on this side, my side team again was saying that they go out with other outreach workers. For example, the folks that help get people enrolled in health insurance, navigators are there, the CACs, but since their primary focus is just getting that person enrolled in health insurance, they can tag team and then provide information to that client about how to use their health insurance and how to get access to services and then get them connected. And that's something that those the navigators aren't doing, so they go out and find some value in doing a tag team.
Mm-hmm. I think that's an excellent suggestion for linking up with navigators or others who have a common interest in that. So, and it also, creates it may be a more comfortable conversation because there's more than one person that that the potential client can interact with. So I think the other things, when you're doing any of this, whether you're meeting with outreach workers or whether you're meeting, with clients, so one of the things you want to do is capture you want to be able to measure whether you're getting any results. And while you would do this, while you're going to do this as individual outreach workers, you're going to do this in the larger context of your program because your program is really responsible for the evaluation. Some of the things that you might want to for scenario 3, it's like, how do you know if time spent with this group of outreach workers is going to result in anything? And you're talking with them after you ask them about, what questions they have about the program to kind of reinforce the information that they may have heard before. But is to ask them, kind of how likely are they to be able to refer potential participants? So this is more of a measure of intention, but it gets at the point of, some of these outreach workers may say, yeah, that's nice, but we don't really have a lot of clients that fit what you need. And that gives you a sense of, is this somebody you should follow up with, or is this somebody who you shouldn't? Because just as with anything, if you're meeting people and giving them information the first time, you should very likely do some kind of a follow-up contact to them saying, hey, I met you at this meeting, know you had some questions, or, I know you seem to be interested, or that it seems to me that your clientele might be a great source of referral into our program. Would like to, do you have any other questions? Have you tried to refer anybody in the past, few weeks? Just to really do some of that follow-up. And then actually, kind of on a routine basis, whether that's once every couple of months, touch base with them if you haven't had a chance to interact with them in another setting, saying, geez, how's it going? Have you been able to share our information with anybody, et cetera. So this is you creating your own network. So, because down the road, what you'd really like to be able to do is to figure out how many referrals or inquiries came from these sources. The other thing we just wanted to briefly mention, and I'm assuming that most places already have some mechanism where you're tracking your outreach activities, so that you can look at what sites were effective. So what you might want to do is, for each of the places where you're doing outreach, whether it's at a hair salon or whether it's kind of beating the streets in a particular neighborhood, you want to record the date, and you want to record, the time of that and the location. And then, for every person that you approached, so you can track this by every person that you approached, and then you're going to need or you can just record the people who you interacted with. But you really want to, and when I put things in here like age and whether they're a minority or whether they're pregnant, this is really your kind of best guess at this, but it gives you a sense of, are you talking to younger women? I don't have I don't have sex or gender in here as a column because most of the people you're going to be approaching are going to be women. But you could make to get a count of kind of who are you seeing, and if you can say, you could even add a category or a column in here that says, that we're approached but not interested. So you get a sense of, are you approaching 20 people and only interacting with one, or is everybody who you're approaching kind of interested in what you're in what you have to say. And so you can see on this particular form, there's just some categories down at the bottom, really intended to make that very simple way to classify the individual. And yes, I mean, you're not asking them what their age is. You're kind of profiling them on, well, this is how old or young I think this individual is. This, do I think that the person is a minority? And you may be yes, no, or you're not sure, which is perfectly fine. You can say, whether they're interested or not interested, whether you gave them something, whether they had a particular question about something. So this can be customized to the worker, customized to your program. It's just a way to start thinking about capturing the volume of work that you do in outreach. The other part that's important for this kind of a form is like if you're in a place where, you didn't have much interaction with people, or that, for example, you're out in the streets, but you had to, you had to end early because there was, the weather got bad. Or you were in a place where, you were doing some great outreach, but, the fire alarm went off. So characterizing that too, so that when you go back to say, oh, geez, that wasn't a very good place to do outreach. Oh, well, that's because we had to leave because the fire alarm went off, or that, we left because the weather got bad. So you can really get a sense of, what sites worked, and what kinds of individuals you identified at these various sites. But this is not something that you're going to kind of evaluate on your own. This is part of your program's evaluation. And so you would, if everybody's using some standardized process, you'd then compile your information and look at this collectively. So I'm assuming that most people are doing some kind of tracking about that. What wasn't certain of is kind of how does that even get managed? Do you track just the people who you talk with? What kinds of information do you try to at least capture? I'm just interested in kind of what people are doing relative to tracking of these activities. So feel free to speak up or chat in the chat box. And if you haven't really settled on an approach, or your organization is kind of trying to figure out what to do to improve your outreach tracking, this is something that we can provide some TA about. Okay, well, we're going to move on to then the fourth scenario. Here is now a partner agency sponsoring an event wants you to have a table there. You're not sure that this is the best use of your time or other people's time in your agency. Kind of getting back similar to the question we had before. What do you want to know about before you make your decision? And then the secondary question is, if you decide not to do a table, how else could you be visible at that event? So just think about some of that. What do you think? Certainly some of the other questions were before, which is like how many people might show up would be a relevant one.
So we also, in thinking of this, if we decide not to do it, we might send materials. We may send brochures or flyers that can then be given out if it's something we decide not to do. Sometimes also in making this decision, while it may not be the best event, if it's part of a collaborative effort that we are part of for political capital, we may be there if we can spare the time, because we're thinking in the future what opportunities it'll have for us or what benefit it'll be for us.
Mm-hmm. That's an excellent point. Which you kind of read my mind, because I was going to say that is one of the things to think about. Sometimes you don't, because it's a partner, that's going to weigh a little bit more than if it was just a one-off request from somebody who you didn't, have an existing collaborative relationship with. Yeah, so you want to look at that as to leverage into the future. Also, it's a place where you could meet outreach workers for other organizations. And, this could be, maybe you're not going to see as many clients there, but you're going to get connected to some other agencies. A couple of other comments who have come in. One is kind of, you want to ask, who is the audience? So who is the audience for this event? And who are they marketing to? And how long is it? So is it, a couple hours? Is it half a day? Is it all day? And what's the, what the expectation is? And then if they didn't do a table, so this is another thought, is that you walk around and you hand out flyers or offer services. So you're more milling in the crowd as opposed to having a table. Because there is an interesting strategy where people, maybe hesitant to walk up to a table. I mean, you've walked by these things, or people in the malls or other places, and you avoid them because you don't really, unless you're super interested in it, going up to a table requires a certain aspect of committing or acknowledging that you have a question or whatever. And for some people that's not intimidating at all, and for other people it is. So being in the event, so if you're walking around and doing that you're also in more control of your time commitment. You say, okay, we're going to be there, we're going to go, the peak time's probably going to be noon to, or 10 to 12, we'll be there then, and then that helps you manage your time better for that. So any other thoughts about being at this event? Okay, so I think we're just going to begin to wrap up here. Again, just as a reminder that the social marketing approach, has the 5 components. So we're looking at, obviously women of childbearing age. We're looking at some products. It could be brochures, handouts, flyers, as well as we're looking at price, which is more in the context of, the resources for the program, whether that's incentives or whether that's hiring a dedicated worker, looking at all kinds of different places. We haven't talked particularly about, community centers, but that's another place that could be used for outreach for sure. Again, we talked a little bit more about the promoting piece, which is, focusing the messages and making certain that the message and the images are kind of culturally appropriate and acceptable. And that in terms of working with partners is what can we do to build our personal networks, as well as our formal and informal partnerships with various organizations. So now what we want to do is, this will allow an opportunity for all of you who aren't talking to indicate your preferences. So we're interested in what are some of the barriers that you have encountered while planning for or conducting outreach. There are several, there are 4 choices, plus you have the option of writing in some barriers that we may not have already listed. And you can just type those into the chat box. So we'll give you a couple minutes to check out these. And again, this is a kind of a check all that apply. Ads and type any of your other comments into the chat box. Okay, we'll give you another little bit. Oh, interesting. So handing out of condoms is seen as kind of an, well, that could be one of those incentives, but that not every agency is necessarily open to you handing out condoms. And that would go back to if you're going to be setting up in a clinic or even at a health fair, places like that, to understand if there are restrictions on what you can hand out, restrictions or expectations. I've participated in health fairs in which you were actually required to do something. You couldn't just stand there and hand out pamphlets. You had to check people's blood pressure, or you had to, do some kind of a screening or something, so that there was a more of a built-in opportunity for interaction. Language barriers identified as another challenge. Yeah, we should probably put that one in there to begin. So language barriers in terms of aren't all fluent in all the languages of the clients that may cross our paths. Many people are afraid of giving their information out due to fear of immigration. Yes, this is this has always been a concern. It certainly in the past couple of months has become a more prominent concern. And I think that also speaks to, as we make decisions about how people are approached or how we position ourselves to reduce that, to minimize that barrier. But we need to acknowledge that it's there. But it may also mean that strategically we may need to go to places that are more likely to be where people who are have those concerns may congregate. And we may have to use more, word of mouth, one person saying another. So you talk to somebody saying, well, geez, if you don't know anybody who needs this, if you don't need the services, do you know anybody else who would please give them this? So we may have to use that more secondary referral because of the current hesitancy with people sharing information. But that's a great point, and thank you for bringing that up. I had meant to comment on that before. And then, we're going to close the poll. The other comment was trying to find the right location. For example, in one neighborhood, the library is a good site, but not in another. Yes, and that really gets to knowing the community and the importance of being visible. And I think that's also where you get into some trial and error. You also get into discussing with the sites what's worked. Also, this is a way that you can use those other outreach partners to say where are the sites that have worked for you and have not worked for you, and why. And it could be that it didn't work for them because your audience was there and not it wasn't their audience. But it could also be that the setup wasn't right. You were put off into a corner. It just wasn't going to be. So you're going to learn a little bit about. Can learn that about some of your other partners. So what we have in terms of the poll, the women not interested seems to be the biggest or the most commonly cited barrier, with the other ones kind of all in the same, 50 or 60% is time, funding, and competition with other programs. And I think, the women not interested, one of the questions I think is that they're not interested because, so are we approaching people because we're just generally approaching a lot of women, understanding that, to get one woman, you have to approach 10, or are these women who are people who we really think probably do need services, but that they are just, this just isn't the right time or place, for them. And I think if there's a way to better, that's another aspect, is there a way to better understand what is it that they're not interested in? So they don't have any needs, or that they really just, prefer not to have anybody else in their life, or that they're getting their needs met by another organization. So I think if you have people who aren't interested, it might, one strategy is to say, geez, well, what kind of programs would you be interested in? As that gives you a sense of what is a potential need out there, if any. So to kind of help you with your program building, but also it gives you a sense of, it may not be that it's not because of lack of services, it's just that they don't have the time or that they're getting their needs met in other ways. Other comments? And we don't have magic answers to all of these other, to timing and funding and competition with other programs and services. Although I would say that, as you work with your partners to try to, identify where that competition is, and if it is really competition, or if in fact what we're trying to do is, there are a lot of women out there, how can we best work together to make certain that we're serving the whole population of women? Because if we're competing for that, it may just be that neither of us is identifying all the women in need. So then, we're curious also are there other kind of techniques that you have found to try to overcome any of these better? So somebody said, I tend to refer to Mitch as a filter program that connects women to services like a bridge that is sometimes useful. So kind of not saying, hi, we aren't going to necessarily fix your concerns, but we can help you navigate or help you figure out how to get into other services or into other programs. That's a great strategy. Okay. Oh, and understanding the other agency role and services. Yeah, so what they do and what makes you unique from them. Great suggestions, comments. Thank you, Melinda and Laura. Right?
And I have a question. Have you come across any literature that describes an effective outreach cooperative, as I'd like to call it? And what you laid out in one of the other scenarios with working with other outreach workers, many times none of us have enough staff to do the outreach for the geographic area we have to serve. And I am looking for models on how you can form what I'll call the outreach cooperative, where we're all going to know enough about each other's programs. And if we just have the capacity to, let's say, cover a 2-block area, and we've got 10 blocks that we've got to cover, and each of the other 4 outreach workers and the other agencies can only cover a 2-block with their resources. If we organize and form more of a cooperative, we can get through that 10-block radius in a collaborative way. And have you seen any literature that just describes doing that kind of coordination?
There was nothing that we found that we ran into in preparing for this, but you're raising an important question. And I think what I'm going to ask is that we'll go back to just do a more specific query about that, because my sense is what you're describing is probably not going to be as much in the published literature, but it may be in what I call the gray literature or in other places where people have talked about strategies. So we'll do a little digging to see if we can, because I totally agree that some kind of a coordinated effort. Now, there certainly are coordinated efforts in terms of people having a centralized screening and then being kind of triaged into different programs, but that's different than doing outreach. The centralized screening is, you've kind of already identified people who may be eligible for services. But we'll go out to look specifically for that because, but there's nothing that we came across about, wow, this would be, an outstanding model for outreach. But I think as our resources continue to shrink, that kind of coordination would be quite valuable. I also think that it helps build your partnerships because everybody is kind of mutually benefiting from this, and it gives you some common space to work in, as opposed to kind of talking about competing for funding or some other things like that. You just say, hey, if we're all together, we're trying to identify these needy individuals. If we pool our efforts, we may be able to use our resources more effectively. Great comment, thank you. And we'll get back that information even if we don't find anything. Another comment was, I guess did I read this one? Yeah. Oh yeah, I read that one before, sorry. But yes, I think knowing what those other agencies are is important. So no other comments. So we're just going to hit a summary here of, so what we've tried to talk about today are some strategies of how to incorporate outreach into your work and some discussion of the different barriers. We've also, used that social marketing model to try to help you think about different ways in which to think about the different parts of your outreach work. And one question, I guess, to close is, what's one thing that you think you might do differently in your outreach based upon today's discussions or the other discussion? Somebody else has just pointed in kind of knowing what the community needs. Yeah, and I think it's important to not assume that you know what the community needs. That's probably one of the biggest missteps people in public health tend to make, is that we think we know what's going on, where in fact, we may very well not. But even if we do think we know, we should validate that. So other thoughts about what people might do some differently, or at least think about in terms of your overall outreach strategies. Other things? Well, I hope the lack of response is that you just have so many things you can't figure out what you're going to say. It does take a little bit to digest this, but I would encourage you to kind of reflect back on, what is your standard approach? How could your standard approach be expanded so it's using multiple strategies? What are the different, as you make decisions about where to spend your time, that you're thinking about, is this the right place? Is it the right, audience? Who else can help me with the outreach in terms of that secondary outreach?
You also even thinking about the day of the week that you're going.
Right.
Like the time of the day that you're going.
Right.
What is the best time to reach your prior population? Are they out there in the morning? Like when I used to do outreach to try to reach substance use users, they were out in the morning trying to get their fix, in a sense. When I worked in the needle exchange program, that was a time to go out and find them. And so think about your prior population in terms of place, but also the time of the week and the time of the day. That's also part of that when you're trying to schedule that outreach time during your work time, your work week, what works best.
Yeah, because it's really not, oftentimes it's, well, I have a couple hours where I'm not scheduled, let me see what I can do, but that may not be the best time for your clients. And to kind of think about, your week, this week, next week, then, the following week, and what are some time windows that you want to make certain that you mark off that you want to spend that time doing outreach, and then you intentionally don't schedule clients into those time slots, because I think it's really easy to have outreach be I'll catch on this when in my unused time, as opposed to it being seen as something that you need to schedule in, just like you schedule in clients. And so it becomes part of your routine, and that, you do on the first week, you're out there doing it on Tuesday afternoons, and then the next week it's, Wednesday mornings, and then the following week it's, Thursday noon someplace, and just kind of vary the time, the day of the week, and the place, but schedule it in as if you had that, as if it were a client, and not doing it in a catch-as-catch-can basis. So I'm right at our hour and a half time frame. We're certainly happy to be on the call for a few more minutes if people have questions. If not, please feel free to reach out to us for some technical assistance through your directly to us or through your supervisors. We do have our standard email. That's the MIHCOE, and that's at urmc.rochester.edu. Sorry, we have a long email. We're happy to talk with you about some of your ideas and provide you support in your success as you kind of expand your outreach.
We also have some upcoming trainings, some in-person trainings, the power of presence. And that training is, I remember in many of the evaluation surveys, people wanted more a training on how to deal with vicarious trauma and how to deal with stress. And so that training is addressing that and providing recommendations on how to cope with that. And also addressing burnout. So please visit our website to register. I think the first delivery is next week. So please visit our website to register. Also coming up in the next couple of weeks is client engagement as well. And we have a few other webinars. So visit the website, the training calendar for those upcoming webinars and in-person trainings. Thank you so much for your participation today and being with us this afternoon, and have a wonderful rest of your day. Thank you.
Thank you all for being patient with me not being Heather.